Okay, now for our information on diabetes, which is the last part of our chapter for chapter 12. So when the book was last updated, it gave the 2013 data, and that has since changed. So please use your notes for this when you study, and make a little side note that the book is incorrect with this. So the Center for Disease Control's recent updates as of 2016, which they go by the 2015 data, is that 29 million people, or 9.3% of the population, have diabetes. It is the fastest growing chronic disease in American history. Some statistics even saying that by 2020, as much as a third of our population could be impacted, and diabetes is the 7th leading cause of death. Indirectly, it costs about $245 billion a year to treat diabetes in the U.S. This picture's in your book, and you don't have to write anything down, but it is interesting to look. If you kind of go back to 1958 and see 1% of the population impacted, and now if the chart would keep going, we'd be at almost 10%. So really, really quickly, this situation is kind of getting out of control. So what is diabetes? It is a high level of sugar, which our body's sugar is glucose, and it is present in the blood. So this high sugar in the blood, and we also see high sugar in the urine, and the reason why is the glucose has to come out somehow. So it ends up being filtered out, and it ends up coming out through the urine. And one of the cases that we see here is hyperglycemia. It's when we have a high blood glucose level, and this is seen majorly in diabetes cases. So what happens in healthy people? Carbohydrates from foods are broken down into monosaccharides called glucose. Now remember, carbs aren't always just simple sugars, but eventually, regardless, even if you have those complex carbs, they get broken down into these monosaccharides. And the liver and the muscle cells store glucose as glycogen and use it as needed to fuel your metabolism, movement, and other activities. So your cells need this glucose for energy. The pancreas is an organ, it's behind the stomach, and it secretes a hormone called insulin. And insulin is in charge of stimulating these body cells to take up glucose from the bloodstream and use it for immediate energy. In a normal person, all of this works just fine. But in a diabetic, it doesn't work right. So let's look at the types of diabetes. The first is type 1, and this is an autoimmune disorder. So the immune system attacks and destroys the insulin-making cells in the pancreas. You may want to put a side note that this is often called juvenile diabetes because this happens in people when they're younger, and literally their pancreas is not releasing any insulin. The risk increases with European ancestry and any type of genetic history, usually to any type of autoimmune diseases, can put you at risk for this. And also environmental insults such as a viral infection can kind of cause the immune system to go a little haywire and then end up attacking organs such as the pancreas. How is it treated? Daily insulin injections are needed for someone with diabetes type 1. Also, an insulin pump is an option where the insulin is consistently throughout the day infused into the bloodstream. And one of these, depending again what the treatment plan is for that patient, is going to be required for survival. And type 1 patients still need to monitor their diet, exercise levels, and also be checking their blood glucose regularly. Type 2 diabetes is a metabolic disorder. This is about 90-95% of all diabetes cases. Now, one of two things can happen here. Either the pancreas does not make enough insulin, or the body cells are resistant to insulin, and that's called insulin resistance. Now, the development of this disease, a few things can happen. One, it could be the overabundance of free fatty acids that contribute to insulin resistance, but also we're seeing that the pancreas really is overworked, so the insulin-producing cells are exhausted and damage occurs. And the book gives a picture kind of explaining the difference. So here's a healthy person. Glucose enters the bloodstream. The cells in the pancreas produce insulin, and then the insulin is absorbed and removed from the bloodstream because it's going into the cells because the insulin allows it to. In type 1, the same thing, we have the glucose entering, but the pancreas is producing little or no insulin because the cells inside of it have been destroyed. and now the glucose is building up into the bloodstream and not entering the cells. And then in type 2, very similarly, we have the cells in the pancreas are possibly damaged, but it also could be that it is releasing some insulin, but the body is resistant and it does not recognize the insulin. Either case, glucose is now kind of building up, it's not being removed from the bloodstream, and the cells are not getting the glucose that they need for energy and to function properly. Now for risk factors, we have increased age. As you age, your body organs start to become overworked and do not work properly, and so that can happen in this scenario. Certain ethnicities like Native Americans and African Americans and even Hispanics have a higher risk. And then also genetic and biological factors play a role. Modifiable risk factors are body weight, poor dietary choices like our high fat and our high sugar type of diets, low levels of physical activity, very sedentary types of lifestyle, we're not getting up and moving enough, sleep patterns that are very irregular or not enough sleep at night. At night, when we're sleeping, our pancreas does a lot of repairing and resetting, so it's important to get your sleep. Levels of stress, high stress does overwork all of our body systems. And then BMI of 25 and greater and the waistline of 40 inches or more in males and 35 inches or more in females, going back to just that weight management and that link to obesity. Prediabetes can lead to type 2 diabetes. So we have a separate condition now called prediabetes, and this is when you are tested, but your blood glucose levels are not high enough to be classified as diabetes, but they're not within the normal healthy range. So they're higher than normal. About 35% of adult Americans fall in this category. And without any type of lifestyle changes, about 30% will develop into type 2 diabetes. And if you go back to the notes from cardiovascular system diseases, we talked about this MET-S or metabolic syndrome, and prediabetes, which again is that high blood glucose, is one of the key factors. That and our waist measurement appear to be the two most dominant factors for the development of the metabolic syndrome. A person with metabolic syndrome is 5 times more likely to develop type 2 diabetes than a person without it. And again, this also puts us at a higher risk for cardiovascular problems like heart attacks and strokes. Our last issue with diabetes is a particular condition called gestational diabetes, and this is a type of diabetes that develops only during pregnancy. So during a routine prenatal exam, at some point they're going to request that you get one of the blood glucose tests done. It's usually the oral glucose tolerance test, and they look at that and decide if you're in the normal range, the pre-diabetic, and if you are at the diabetes range, and you have no other history of diabetes, they would classify this as a gestational diabetes situation. Most times, after you have the baby, your blood glucose will be returned to normal, although that doesn't always happen. There is a risk that this would progress into type 2 diabetes after the pregnancy ends. So the doctors would monitor it, and you'd be checking your blood sugar throughout the regular pregnancy and just making adjustments as needed. Medication would be administered if needed. But there is an increased chance of complications for the mom, such as labor problems, high blood pressure, this high blood acidity, which could lead to a coma, increased infections, and so on. The fetus could also be endangered. There could be some issues with the heart, the nervous system, the bones, some respiratory problems. So it is just something that the doctors will monitor and check for. What are symptoms of diabetes? These are some of the most common. Thirst, excessive urination. Again, the body's trying to rid itself of all this extra glucose, so there's a lot of urination. Weight loss and fatigue is a really big one because the blood has all this glucose because the cells are not getting it. So the cells are not functioning properly, which can lead to a lot of tiredness, just really low metabolism. Nerve damage, blurred vision, and poor wound healing and increased infection. Some complications, if you've ever heard of diabetic shock or diabetic coma, it could be a result of diabetic ketoacidosis, when you have this high blood acid level or ketones. And so it's just, again, really important to be checking your blood sugar regularly. You could have cardiovascular disease, kidney disease, increased chance of amputations because the blood is not circulating to the limbs properly. And so the extremities are not getting enough oxygen, they become infected, wounds do not heal properly, eye disease and blindness, flu and pneumonia related deaths, and tooth and gum disease. And these pictures are in the book, but you can see the complications here with this guy's foot, just the infections that are not healing, blood not circulating again to the limbs properly. And so that ends up resulting in a lot of amputations. And then we have issues going on with the eye where it can cause blindness. There are 3 main blood tests to diagnose and monitor diabetes. The first is fasting plasma glucose test. This is where you fast overnight, so you don't eat anything. You come into the doctor's office, they take your blood, and they test it for the glucose concentration. The oral glucose tolerance test is when you drink a liquid containing concentrated glucose, and then within an hour to 2 hours later, your blood is taken and tested for glucose concentration. And the last is the hemoglobin A1C test, and this is a regular blood glucose test done by a physician every 3 to 6 months. Most people would have one of the top 2 done for the first initial diagnosis. Depending on what test you take, the score that you get back would determine your diagnosis. So with the fasting test, if you have 99 or lower, you're considered normal. Pre-diabetic is 100 to 125, and anything over 125 is considered diabetes. With the oral glucose tolerance test, 139 and below is normal, 140 to 199 is pre-diabetic, and diabetes would be 200 and above. Lifestyle changes can make a huge change when you look at diabetes type 2 and pre-diabetes. Some people that are diabetic type 2 have even been able to control it just with lifestyle changes. Many that are pre-diabetic can actually delay or prevent the onset of type 2 diabetes because of the changes to their life. So the first one, major one, is getting that weight loss, making sure that you bring that weight down to the healthy weight that you should be. Even losing as little as 5% of your body weight and just increasing your physical activity can really lower your risk of complications or progressing to diabetes. Adopting a healthy diet, cutting out those high fats, cutting out your sugars, switching to whole grains, high fiber, fatty fish, fruit, vegetables. We're talking raw fruits and vegetables. And the next one is just getting that increase of physical fitness up to that 150 minutes a week. Many type 2 diabetics also control their diabetes through oral medications, and they reduce the blood production in the liver, they slow the absorption of carbs from the small intestine, they increase the insulin production, and they actually increase the insulin sensitivity of the cells. So they help in many, many ways. Obviously, type 1 diabetes, they would need that insulin shot or the insulin pump to maintain their insulin levels. People who have undergone the gastric bypass do seem to have higher rates of cure when we look at diabetes, but again, that includes a lot of serious complications, so you got to be willing to take that risk. And lastly, we're looking at insulin injections. We talked about this just a minute ago, but it is essential for those with type 1 diabetes to have insulin injections. Insulin cannot be taken in pill form because it's a protein and it would be digested in the gastrointestinal tract, therefore you would get no benefit from it. So it is essential because they have no insulin production at all with type 1 diabetes. Now, type 2 diabetes, they may be fine with the oral medication, but if their body is not responding or maybe they're not really just monitoring their lifestyle the way they should be in conjunction with the oral medication, they may need to do the insulin injections also. Most people opt to use a pump if it is something that they have to do regularly because there can be complications with daily injections. Okay, that's it for diabetes.